know that almost 90% of headaches don't really start in the head? Instead, they're generated directly or indirectly from the neck. Most of us reach for the pain reliever, but our next doctor says an attitude adjustment is a better place to start, as in an adjustment in how we diagnose and deal with headaches. No pain medication, no surgery. Please welcome back chiropractor Dr. DeRamus with Sandstone Chiropractic. Good to be here.
And before we get to that, I just want to say, wow, you just kind of wrapped up your duties at the livestock show and rodeo, where you get those cowboys out there, and they must have all kinds of issues.
Different injuries than most athletes, for sure. And they're probably some of the toughest athletes I've ever seen in my life.
Wow.
But it's exciting to do, yes.
All right, let's talk about what chiropractic medicine is. I think this is an area where sometimes people are confused as exactly what it is.
Yeah. Most people, when they think about chiropractic, they're thinking about the spine and the adjustments, whereas the popping and cracking that we do. But really, overall, chiropractors, our jobs, our focus is to reduce stress on the body to increase function. And whatever means that is, whether it's through the spine, whether it's through nutrition, that's our area of focus. We're not subject, we don't prescribe medications. We feel the body is designed to be able to heal itself. We just got to give it the right stuff.
Yeah, and it's almost like getting a tune-up. When you go to a chiropractor, you get a tune-up to keep things going, as opposed to those other critical things that we go to the doctor for. All right, I had mentioned to you the last time you were here, I was waking up every morning with like a headache on the back right bottom part of my head, which concerned me. I'd never had a headache like that before. And the first morning I woke up and I went, okay, I took some aspirin, but the next morning and the next morning, and for about 2 weeks, I was really getting concerned about what that might be. And you just kind of felt up my neck, and what was happening there?
I mean, you can feel the tension in the neck. I remember when I first started in school, and one of the students did the same thing to me, and I thought, wow, that's pretty amazing how you did that. But once you touch enough spines and you see what's normal, you can know what's abnormal as well.
Yeah, and then so you could feel that, like, all my stress was sitting right there, and then you did that adjustment thing. So you did a couple of things, and one of them was where you actually see, now right here, what are you doing?
Well, that's our standard, what we call a side posture maneuver, that we're actually using that to adjust the lower spine.
Okay, and then you got into the neck, and you actually took my head and you did the twist.
Yeah.
And I got to tell you, whatever you call that. I'm sure there's a medical adjustment, but I have to tell you, and when you look at it, it looks so simple. We are so trained to believe in surgery and pills only that we don't think things like that can make a difference. I've not had a headache since.
Yeah, good job. That was awesome.
There you go. All right, so headaches most of the times don't necessarily start in the head.
And that's what's deceiving about headaches, because they're usually in our head. But most people, when you ask them about the headache, they'll say, well, it kind of starts here and it goes to here, whatever part of the body it goes to.
Yeah.
But if you look at the anatomy of the upper cervical spine, there are multiple neurological structures that drop down that actually travel into the front part of the face. We also have a nerve that comes out of the second bone in your neck that turns into what we call the greater occipital nerve. So there's a direct connection that we have with the upper part of the spine and also with headaches.
Okay, a lot of us carry our stress, so we say, in certain parts of our body, because stress goes somewhere. That's why it's so critical that we can offload that.
You bet. Well, and that's where they get the tension headaches, is because it's a muscular contraction headache. So you can either have that through emotional stress causing the tension. What we're seeing now is a lot of people are developing this posture where they're leaning forward this way. Now, the head doesn't want to look down, so it extends itself back up like
computers and things like that?
Computer work, that. And we see that all the time, but we're seeing it more often in kids as well.
Okay, a couple of things to clear up here. I think how many of you think, like, if you go get adjusted, that it's supposed to hurt, or that hurts, right?
Yeah.
It didn't hurt at all.
No,
actually felt kind of good.
It never does. Chiropractors should be very specific about where they need to adjust. There's no sense in changing a tire that's not flat. So we know exactly where to go. But then the actual skill of making the adjustment should be very smooth, and it's very safe. But if patients still can't get through the popping and cracking, we use other methods as well that don't require the popping and cracking.
How often do we need this tune-up, so to speak?
It really depends. I mean, like, say, for instance, one of my first headache patients that I dealt with when I first started in practice, I had him for 50 years. And she was 25 when they started and 75 when she was in the practice. And in about 2 months or so, they started to dissipate. Now, she wasn't there for the headaches. And then after about 4 months, then they were gone. Now, your headache was different because it was gone within one.
Yeah.
So you can't really determine. You have to really understand the mechanism, why the headache is there, and then treat it appropriately.
Yeah. All right. So there's the headaches in the spine, but then other parts of the body, and it's kind of like that song, the hip bones connected to it, right? So it's all kind of interconnected. So your other job is make sure the body is in alignment so that one part of the body doesn't throw the other part of the body off.
That is correct. And so we know that the spine is a very unique part of the body. It needs to move in all different planes of motion. So when it doesn't, everything else will cascade along with that. But now it's really interesting because posture is becoming such a big deal that even our medical doctors are doing research and saying, wait, this is just not affecting the spine, but it's affecting every part of the body. And we've been saying that for over 100 years. You know, if you lose that communication from the spine to the rest of the body, it's just not going to work like it should.
Yeah, all right, because I know that, let's see, my right knee's giving me problems. I'm overcompensating with my left knee. Basically, I need every doctor who's here today. So, all right, Dr. DeRamus, thank you very much. I'm telling you, that was quick, it was easy, and done. To learn more about chiropractic care and to find out if it can help you, visit sandstonechiro.com or call 936-851-1631, 936-851-1631. In this case, instead of the medications and things, you can help your body help itself. Okay.